What's up, friends? Welcome. It's time to elevate and thrive. And today I have Dr. Angela Yagle here,
What's up, everyone?
and we are diving into one of our fall rejuvenation topics, and that is hair loss and hair restoration.
Such a great topic. I mean, it's really for the people that it's affecting, it is, it kind of dominates their life. It becomes really one of their top concerns in the moment when it's happening. So
It's tough because it's one of those things that, just like your face, your hair is part of that visual appearance and it becomes really part of your self-identity.
it really does. I mean, yeah, I would say anybody who's experienced any hair loss has absolutely realized like kind of the emotional and the kind of psychosocial impact, that it has like when you're around other people. And that's when I have patients that are coming in with that concern. I mean, that really, they're like, I notice it when I'm in groups. I get very self-conscious about it, right? It goes,
Anxiety,
yeah.
confidence, of those kinds of feeling like I'm not myself, looking like I'm looking at a stranger when I look in the mirror.
Yeah. And also the concern of like, how long is this going to go on? Is there,
How bad is it going to get?
right? And what if there's nothing I can do about it? Which we know is not true.
And that's really what we want to talk about today. So if you're in that boat at all, whether, you're starting to know some thinning or maybe some patching or just something that you're worried about and you want to get a little bit more educated, we can talk to you from our perspective about how we utilize a variety of different tools, different treatments to find ways and reverse, slow, do what we can to have a positive impact on your hair health.
Yeah, absolutely. I mean, as we'll talk about today, I mean, there are a lot of different areas that we need to address when it comes to hair loss. So if you're coming in to see us and you've never talked to anyone at this point about what's happening with your hair, I mean, we need to do a deep dive into several areas. Like, definitely stress. We need to look at diet. We need to look at your vitamins and nutrients. We need to look at different labs. And then we need to talk about a bunch of different solutions.
Yeah, and part of what we're also looking at and is your genetics and is your gender. So when it comes to hair loss, hair thinning, it's a little bit different for men and women. There's some different factors at play and some different biological mechanisms. So maybe let's talk just a little bit about the difference between what's happening with men and women when it comes to hair loss.
Yeah. As we know, I mean, definitely the genetic tendency to lose hair is absolutely much stronger in men, right? It's called male pattern baldness, and many times, I mean, the things that we're going to talk about, I think, are still relevant for men, and especially some of the procedures that we'll go over. But, there are some men that are going to have to go, if maintaining their hair is absolutely a number one goal and they'll do anything to stop it from happening. Sometimes those people, if genetically it's usually their mother's father, lost a lot of their, his hair early, though that person might need to reach for other alternatives as far as like hair transplants, things like that. But what I have seen, I'll say for men, even though that again had that tendency that they wanted to postpone, they're like, look, I know that eventually I'm likely going to have to do the surgical intervention, but I'm not there yet. I'm only 30 and I'm really not ready to, I see the thinning. And so we've done all the things we're going to talk about today, and it's been helpful and it's worked. And so it might be able to buy you some time,
Sometimes in the hair game, what we're looking at is slowing things down. It's similar to anti-aging. We can't actually stop the aging process, but we can do a lot to optimize. We can do a lot to really support the body and to support as many of the positive mechanisms and prevent some of the negative mechanisms at play. And that is a very similar way we kind of want to look at hair, is that sometimes we can create actual regeneration. We'll talk about some really exciting therapies that actually can create regrowth, regeneration, and re-spark actual new hair growing. But in those cases where that's not possible, I think that's a great point you're bringing up, that we can slow things down.
Absolutely. And for women, genetics really are in our favor, which is great related to hair. There are some women that, it is in their family and they have seen it, in their mother, their sisters. And I would say the same thing applies for them as it does for men. A lot of times for women, though, what they're dealing with many times is stress, hormone imbalance, nutrient imbalance. and sometimes some of the other hormones like thyroid. So we need to explore those for women as well.
Yeah, we look at these lifestyle factors. So you're talking about we have genetic factors, then we have our current state of biology, what's going on in our body, how the body's functioning, what's working, how the hormones are working, all these different, cofactors. Then we have our environment, which plays a big role in potential impact. You talked about stress. Yeah, there's stress, sleep impact. And then we have different kinds of food and drink consumption. People who are, tobacco users or whatever, all of these things, excess alcohol consumption have a negative impact. So these lifestyle factors also have quite a bit to do with turning on and off these biological processes and switches in our body, right, that can put us in a state where we're either functioning or not functioning that well.
Yeah, and I think what you listed really are a lot of different potentials of stress, right? So we might not think of, smoking as stress because it's, it's like, no, it's relieving stress. Well, it's an oxidative stress on your body, or excessive alcohol intake. It's another stressor on your body, or poor diet, right? So it's all really coming back to, the body's ability, right, to repair and grow. And if we have too many of those stressors, yeah, absolutely, it could impact hair growth, completely makes sense.
It seems that for most people, they start to notice something is going on. They start to get maybe some hot spots or notice some thinning or whatever. And they immediately start thinking about like, well, what do I need to do to stop it, right? So we're going to talk about that. But we want to, you really need context to understand why it's happening in the first place and recognize that there's a complex interaction of your environment, your body, and your genetics that are all contributing to the current experience that you're having and the future experiences that you might have. So with that in mind, maybe let's talk a little bit about some of the natural approaches or some of those, alternative approaches people might get into initially when they're starting to do some research or wanting to do some interventions.
Yeah. So one thing that we also have to remember, I just want to point out that sometimes if you're noticing kind of a more recent hair loss, hair is on a 3-month cycle. So just if you are experiencing this and you're thinking, yeah, now I'm having significant hair loss, and a lot of times we have to go 3 months back. So I just want to put that out there. So we kind of keep that in context, because sometimes people can have had life events that happened a few months ago and now that are improving, but the hair just is now, it's responding to it.
It took a hit.
It took a hit, and now it's going to take 3 months for it to come back. So given like that's the scenario, if it's like one thing, you were in a car wreck and then all of a sudden a huge stressor in your body, 3 months later your hair falls out, right? So you can think of using a lot of these natural things to really support the regrowth of this hair. And this really applies in any situation, but especially if whether we have like a single stressful event or if we have an ongoing stressful event. And as we talked about, these stressors can come from different areas, and we'll talk more about that related to on the medical side. So, but the natural approach, so topicals, things that we can consider are like, if you do a base, I really like doing like a base of olive oil, or sometimes there are other gentle oils. And then you mix in like rosemary, actually has been studied to encourage growth of the hair. It's pretty cool. So you want to rub it in at bedtime. You're going to smell like an herb garden. That's okay. It can be nice. And I like comboing that too. So actually there have been some studies around topical melatonin. So they used to make on the market, there was actually a topical, like a cream, but I haven't been able to find that. So now what I'm just telling people to do is you get a very natural liquid melatonin, and you could mix it into your own oil or your own cream, and then combo that with rosemary, and then you apply it at bedtime. So, and it'll help you sleep a little bit as well. So as far as topicals, those are some of my favorites that are natural. And then when we're looking at, say, if we're going into diet, we really want a whole foods diet that's rich in protein, because those amino acids, those protein building blocks are going to be part of what your hair is basically going to use as a resource to become stronger.
Which is why we've seen an increase in uptick in collagen-based products and the collagen.
Absolutely.
Great.
Yeah.
Sorry, it's like,
yeah. My hair. Yeah.
Hair,
yeah.
skin, nails.
Yes. Yeah, absolutely. So Yeah, that's a fine alternative as well. So if we're thinking about bringing in supplements, collagen is great. And the thing about collagen, though, that you have to keep in mind, it's a very large molecule. It is going to take time to make a difference in your growth because the body, it's kind of a slow absorption, actually. And for the body to take those molecules and get it into the system and plug them in, basically, it's going to take time. Now, it will work, so just keep up with it. Don't get disappointed by, like, it's been 2 weeks and I started my collagen and I'm not seeing anything. Just keep going. And because also you have to remember, again, it's that cycle of the hair as well. Right?
Especially with any of the natural style remedies, these more gentle interventions, more gentle, longer term. You can almost think about these as foundational. These are really good habits to build that create positive benefit over time, but they're less dramatic than the more intensive medical interventions and medical treatments that we're going to be talking about. So just always keep that in mind. Anything like that, taking supplements, absolutely can make a difference. It's a slower process.
Yeah, it is a slower process. So other things that typically you'll see, over the counter as far as supplements that encourage hair are going to be biotin. I like to do between 5,000 to 10,000 micrograms of biotin. It's really good. So it's a higher dose. You want to do natural folate and usually in a combination of some sort of bees. You also want to there are a bunch of herbs that are actually really good for hair strengthening. And so that's going to be like horsetail is one, witcher's broom. And you'll see all of these like in the blend many times that have the folate and have the, it's a mix of the collagen and
it's a hair support.
It's a hair support formula. Yeah, you're going to find all of these things and vitamin C and plus some minerals. So all of those are helpful for hair. And what I like to do in particular is check, for the ones that we can check through the lab, I like to see them.
Yeah, this is a great example where we use testing to understand how do we create a personalized supplementation program for you based on your specific deficiencies. And if we have the opportunity to do additional genetic testing to understand how your pathways work, this is another way that we can create a hyper-targeted, hyper-personalized plan based on what your body's deficient in, but also how your body processes various minerals and all the different genetic markers that we can look at as well.
Yeah, I love it. Yes. So the standard lab, I definitely want to see iron. I want to see stores of iron. I want to see bees. I can do a mineral panel. But, as you said, we can also, if you'd like to go a little further, there's definitely specialty lab testing where we can check like amino acids. We can get into antioxidants. We can get into even need for probiotics and digestive enzymes, and then your genetic need for these different vitamins as well. Yes. Thank you for the reminder of that. That's really where we like to, if we're talking about personalized medicine, it's like, if you're willing to do that deeper dive into your health, I love it. It's awesome.
Totally. This is a great idea because, when you think about the hair issue, it's, connected oftentimes to other things going on. And the more knowledge you have, the more self-empowerment that you can have about your body, right? Because it can have ramifications on your energy, your vitality, your immune strength, like all of these other factors, your biological aging, how, all these things. The more knowledge you have, the more informed decisions you can make, and more we can help you to create really a path for you to feel amazing, look amazing, and just be your absolute best.
Yeah, I love it. Knowledge is power. So the other labs I'd want to see, I want to look at your thyroid levels. I want to look at your adrenal levels. That's cortisol and DHEA. I want to make sure your testosterone is not too high, because definitely elevated testosterone or dihydrotestosterone, DHT, especially for men, if it's too high, we need to correct that. For women, we just want to make sure all the hormones, your estrogens, are also in balance as well. You're not going through wild fluctuations. And then again, as I mentioned, like the different vitamin testing too.
Sounds like a lot of testing, but oftentimes this is just
it's
a couple different panels. We run it all at once, so don't freak out. It's not like we had $10,000 in testing later.
Most goes through insurance.
Most go through insurance, and this is often just a series of tests will all run together, one lab visit. So after we go through all of that, right, then now we're equipped to make more informed decisions. And let's say you're more interested in more aggressive, stronger treatments. That's when we can look at a number of things we do here in office that we would look at potentially exploring.
So So that's where we're thinking about, if we're kind of taking some larger steps. I really love hair PRP. So that's platelet-rich plasma, and that's an injection therapy. And so that is, PRP is a therapy that's been around since the 80s and is now used in many different areas of medicine for regeneration. Actually, say like UW does PRP injections for joints. That's the University of Washington, as well as Swedish has started doing them, another hospital. So it's a very popular therapy. The cool thing is it's your own blood. It's the platelets are extracted and they release growth factors that stimulate hair growth really, really well, So it's very safe. I know it sounds very unusual. It sounds probably really odd if you've never heard this before. But yeah, very safe because it is just an extract of your own blood that we activate with calcium and oxygen. And then we can take it and inject it into your scalp. And what's really cool in the studies, there have been a lot of really good studies on hair PRP. Women have somewhere between like an 85 to 90% response.
High success rate.
High success rate with PRP for women.
So this is for ladies if you're seeing some thinning or a little, this is perfect for that. Or there's maybe a part spot that's starting to get a little bit bigger, noticeable. You're feeling like there's a little bit of a little patch area, kind of, this is something we would absolutely look at and you should absolutely consider because it has a very, very high success rate.
Yeah, absolutely. 100%. Now, actually for men, it can also be successful. However, depending on the studies, we're looking at more like a 50 to 65%,
This is where we want to have some more insight into what might be causing the hair loss or the thinning, So again, this might be a slowing thing for some people, but yeah, a lot of success with guys as well.
Yeah, there's definitely potential there to try it out. And I have seen, where, treated somebody recently where he had that kind of central like thinning at the top of his head and then also at the vertex, getting those V's kind of at the front, where he did 3 treatments, which is standard, kind of one every, depending on your schedule, 4 to 6 weeks. And it is nicely growing back in. We're getting all these great, like, little hairs that are sprouting up all over, which is fantastic. And so it's looking more full and rich. And actually what's kind of cool is that for many people, if they're graying a little bit, it'll flip their hair color back on. Just really fascinating.
That's cool.
So, yeah, it's really cool. Yeah.
Yeah, there's another type of injectable too that's kind of that next level in terms of strength that is kind of a newer thing. I mean, it's been around for a little bit, but it's pretty exciting to talk about.
Yeah. So these are getting in. There's a bunch of different names for this. Essentially, it's an extract of an amniotic cell. There has been some change in the name of their names, but essentially it's a stem cell, an amniotic stem cell, which is also known, as you'll see it, as marketed as exosomes, as well also like amniotic fluid or amniotic biologics. All of those have basically stem cell-like activity. They are stem cells that have been sourced just from an amniotic, either like the umbilical cord, placenta, or amniotic fluid. So you're thinking about, you're not harming a baby, but you're getting this really brand new cell that can release growth factors. Like you think about the regeneration potential of just, of these new cells are pretty amazing. And so I had a gentleman who was thinning overall. He was just having widespread thinning and he was graying. And so injected one time, I did his full scalp and it completely brought back his color, which is really cool. And just, he was like chia head. We were laughing, like his whole head just exploded with hair. It was awesome. So, there is, of course, results vary from person to person, but it's a powerful way to really push your hair growth. We like to also combo that with PRP. You don't have to, but because usually you want to make your amniotic cells go as far as possible. And usually when you're buying them, you're only getting a very tiny amount. So we like to use the best of both worlds and combo that, put that in the PRP, and then you can just go crazy and inject it wherever you like.
Pretty exciting stuff.
It's very exciting. Yeah.
There's also things that we don't do here, like, interventions that are more intensive surgical procedures. So, for some candidates, when we're talking through and looking at different things or trying different things, we might get to a spot, or they might, you might get to a spot where you say, I'm really looking at a surgical intervention. And there's a number of different kinds out there. You're at that stage, you've already researched it. There's an older technique, strip style FUT, and a newer technique, the FUE, which is oftentimes robotic assisted, where they were replacing the individual follicles. And that's pretty cool stuff.
Very cool.
Yeah, very cool. And definitely, I would always recommend go with the new tech on that kind of style stuff. Those old strip procedures are pretty gnarly.
Agreed. Yeah. The newer, where they can actually one by one. It looks more natural.
Yeah, it looks more natural. I mean, they use robotic imaging to map all your follicles, and they use these precision robot arms to put them back, to put them in. It's pretty crazy.
Yeah.
Yeah. So there's things like that if you need that. But before that step, which is a very costly, very, very high investment step, there are a lot of really powerful therapies that we talked about today that we can use to move things in the right direction, and sometimes, prevent the need to having a more expensive, intensive surgery.
Absolutely. I mean, it's worth, exploring any potential underlying causes, right? Maybe it's your DHT is really high, that dihydrotestosterone. We can get that down. It's going to slow your hair loss down for sure. Maybe your thyroid is way off, or you have no iron. If you're iron deficient, you'll lose your hair, right? So, there's a lot. And sometimes, actually, one thing I forgot to mention is that sometimes people are taking certain medications that also impact their hair, and they don't realize it, whether it's a blood pressure medication or certain antibiotics or antifungals or, oh gosh, yeah, I'm forgetting one of the last ones I was thinking about, but it's worthwhile, because it might be, even if, say, that medication, it's a chronic use medication, you need it, there might be an alternative that just doesn't impact your hair.
It's a really good point. And there are some prescription medications as well that can be used, like topicals for.
Yeah. Well, so you're talking about just the Rogaine?
Yeah.
Yeah. So yeah, you can do Rogaine. Rogaine has been successful for a lot of people. It definitely helps you to hold on to the hair that you have and can encourage absolutely new growth. The only tricky thing about Rogaine is that you can't stop it, because once you stop it, you're going to go back to basically where you would have been without the Rogaine. So you're going to have massive loss, because it basically takes you back to the beginning. Yeah.
It's like all those shows where it's like the vampire who's like, all of a sudden instantly turns to ash, right, or whatever, all the years catch up with them, and they just it's like the
hair is like little fall.
Yeah, they just start snow falling, your hair just pulling out from you stop there. Yeah. So but that's where we can consult on those things and get into your unique situation to help come up with a really sustainable game plan, and a plan that can really flip the switch and put you back in this position where you feel that confidence and that connection. Your hair is happy and growing and healthy.
Yeah, that's where I absolutely want to get you to, like happy hair.
Happy hair. Well, if that's something you're interested in and you want some help there, of course, that's what we're here to do. Reach out, book online, give us a call, swing by the office, and we'd love to chat with you more about your personalized plan and how we can help.
Yeah, would love to see you.
Catch you on the next episode.
Bye.
Bye.